Level 0, the silent setup. Your heart isn't screaming, it hasn't learned how yet. Blood flows like quiet rivers, cells exchange oxygen without fuss. There's pressure in the arteries, not emotional, but biochemical. Fatty streaks line smooth walls. LDL cholesterol lingers, not as a blockage, but as potential. It feels normal, routine. But inside you, invisible changes brew. Inflammation simmers. A blood vessel's inner layer thins. Somewhere near a coronary branch, a plaque cap weakens. This is level 0. The system is primed. The cascade has begun, but nothing ruptures. No pain, no shortness of breath, no symptom demanding attention. Just quiet instability, the kind that always comes before the crisis. And heart attacks, they often start here, balanced on a knife edge of biology. Level 1, the angina warning. It begins with a whisper. A tightness behind the breastbone, fleeting. Maybe during a brisk walk, shoveling snow. Oxygen demand briefly outstrips supply. Ischemic cells send faint distress signals. From the outside, you might brush it off as heartburn, muscle strain. But inside, it's a factory of imbalance. Blood flow constricts slightly. Plaque builds, arteries stiffen. Then, a sharper pang, gone as quickly as it came. This is stable angina, the kind that comes with exertion and fades with rest. But it can signal danger, force a pause, reveal the first crack in the facade. Millions experience this yearly, a warning shot many dismiss. Listen to your body. If exertion brings chest discomfort that eases with rest, see your doctor. Don't assume it's nothing. Level 2, unstable angina/minor STEMI. Now, the warning grows teeth. The pain doesn't just appear, it lingers, intensifies, strikes unpredictably, resting on the couch, waking you at 3 a.m. A plaque has fissured. Tiny blood clots form like scabs over the crack, severely restricting flow. This isn't stable. This is unstable angina or a minor non-ST elevation myocardial infarction, STEMI, a partial blockage. Damage is starting. Troponin proteins, markers of heart muscle injury, begin leaking into the bloodstream, detectable only by sensitive tests. Pain radiates, jaw, left arm, back. Cold sweat beads, nausea stirs. The threshold is crossed. This is an acute coronary syndrome. This is an emergency. Call 911 immediately. Don't drive yourself. Chew 325 mg aspirin if available and not allergic. Minutes matter now. Level 3, the major STEMI. This isn't just a blockage. It's a full rupture. The plaque cap tears open. A massive clot forms instantly, sealing the artery shut like a cork. Oxygen-starved heart muscle begins dying now. The EKG screams, ST elevation. This is a STEMI, the classic, devastating heart attack. Pain is a crushing, unrelenting vice. Not a pang, an anvil. Breath comes in gasps. Dizziness threatens consciousness. Skin turns ashen. Inside, a wave of cell death spreads outward from the blockage. Every minute, more muscle turns to scar. The widowmaker, a left anterior descending artery, LAD, blockage, is particularly lethal, threatening the heart's main pumping chamber. Survival hinges on speed. Every second counts. Call 911. Aspirin. Emergency services activate the cath lab before you even reach the door. This is a race against permanent damage. Level 4, cardiogenic shock. A wall of failure. No single blocked vessel now, but a heart too damaged to pump. Blood pressure plummets. Organs starve. This is cardiogenic shock, the heart attack's brutal aftermath in its most severe form. It happens when massive muscle death, often greater than 40%, cripples the heart's ability to eject blood. Lungs flood with fluid. Kidneys shut down. Confusion sets in as the brain suffocates. Despite opening the blocked artery, the pump itself is broken. Survival rates plummet below 50%. Intensive care, powerful 4 medications, and often mechanical pumps, like an IABP or Impella, become the desperate fight to sustain circulation long enough for any recovery. This is critical. Immediate advanced life support in a cardiac ICU is the only chance. Level 5, cardiac arrest. The engine stops. Electrical chaos, ventricular fibrillation, or utter silence, asystole, replaces the heartbeat. No pulse, no breath, collapse. This is cardiac arrest, the heart attack's most feared consequence, though not all arrests stem from attacks. Blood flow ceases entirely. Brain damage begins in 4 to 6 minutes. Without immediate CPR and defibrillation, survival drops 10% per minute. It's not just stopping, it's systemic collapse. In 2023, over 350,000 out-of-hospital cardiac arrests occurred in the US alone. Bystanders CPR and AED use double or triple the chance of making it to the hospital alive. Asterisk call 911. Start hard, fast chest compressions, 100-120/min. Send someone for an AED. Use it immediately when available. Don't stop until help takes over. Asterisk. And that's when seconds decide survival. You cannot afford to freeze or guess. That's why I created this 60-second heart attack response protocol. It's a simple, step-by-step PDF guide showing you exactly what to do, from recognizing the first symptom to performing life-saving CPR if needed. Click the link right now in the description below to download your copy instantly. Print it. Put it on your fridge. Keep one in your wallet. This could be the difference between panic and action when it matters most. Get your protocol now. Level 6, Post-Heart Attack Complications. One crisis is overwhelming. Multiple failures are a siege. This is the complication outbreak. The initial attack weakens the heart, leaving it vulnerable. Dangerous arrhythmias, like VTACH, heart failure flare-ups, fluid overload drowning the lungs, blood clots shooting to the brain, stroke, or lungs, ruptured heart muscle, or deadly infections. Like tornadoes spawning from a supercell, these complications don't wait their turn. They hit in waves, overwhelming recovery. Managing them requires constant vigilance in the CCU, medications, monitors, procedures. A 2020 study showed nearly 25% of heart attack survivors face a major complication within 90 days. Recovery is fragile. Strict adherence to medications, rehab, and follow-up is non-negotiable. Watch for new symptoms relentlessly. Level 7, End-stage heart failure. The scar tissue left by the attack remodels the heart. Walls thin, chambers enlarge. The pump weakens relentlessly. This is chronic ischemic cardiomyopathy, often leading to end-stage heart failure. Breathlessness at rest, swollen legs and belly, constant fatigue. Survival measured in years, sometimes months. Quality of life diminishes. Transplants or permanent mechanical pumps, LVADs, become the last resorts. It's the long shadow of the initial event, a life irrevocably changed by muscle lost long ago. Prevention and early, aggressive treatment of the initial attack are the only defenses against this level. Lifelong management with medications, diet, and activity is essential. This level is about endurance. Save life with PDF. Don't forget your 60-second heart attack response protocol emergency action plan.